Okay guys, Timmy coming at you here. And today what I'm going to do very quickly is I'm going to review the electrical conduction system of the heart. Then what I'm going to do is go into how the electrolytes actually move within cardiac cells to produce that electrical activity. And again, the devil's in the details. So to really understand fluid and electrolytes and how high and low levels of electrolytes will affect nerves and the electrical conduction system of the heart, you have to understand these details. So very quickly, let me go through this. And if you've had general A&P or advanced A&P or both, then you're familiar with this. We know that there are specialized cells within the heart. And these specialized cells, they don't contract. What they do is they produce on their own electrical impulses that cause cardiac muscle to contract. And we know that the pacemaker of the heart is the SA node. So in a normal heart, the sinoatrial node, this group of cells, is going to fire rhythmically and repeat its electrical activity so that you have more than one heartbeat each day. So I don't know, maybe a to-do list. You could think about it like study pathophysiology. That could be number one. And then number B could be have more than one heartbeat each day. Okay. All right, so watch. So the SA node, its intrinsic rate with no nerves affecting is about 60 to 80 times it will fire each minute. And when it does, because you know that heart cells are different, they have intercalated discs and gap junctions that allow these individual heart cells to function as if it was one giant heart cell. So when the SA node fires and produces its electrical activity due to these gap junctions, the electrolytes are going to travel instantly over both the right and left atria. I shouldn't have put that arrow that way. So it's going to go this way. And if you remember from advanced A&P, on an EKG, you're going to see this little wave on the EKG called the P wave. So the P wave represents what's referred to as atrial depolarization, or the electrical activity in the atria. And as you also know, you know that you don't want the atria and the ventricles to fire. So there's this little rubber washer that separates the atria from the ventricles, because you want the atria to contract first to push that additional blood into the ventricles so you get a nice blood flow to your body and brain when you learn A&P. Yeah. Now let's get a new color here. I don't know, what about green? All right, so we got the P wave. Now, you want the atria to contract before the ventricles, but this little fibrous, non-electrical conducting ring, this little rubber washer that separates the atria from the ventricles, is preventing that impulse that was generated in the SA node from getting to the ventricles. So you got to have a way to do that. And that is the next portion of the conduction system called the AV node, or atrial ventricular node. And in the AV node, the impulses that were generated by the SA node get funneled into the AV node. And the AV node, there's a little bit of a delay. So the impulse just sits there and picks its nose a little bit or something. Maybe updates his Facebook status. Yeah, that's it. And the reason for that delay is to allow the atria to contract and push that additional blood into the ventricles, right? That's what you want. And once that impulse, that delayed impulse in the AV node is over, then it goes through the bundle of His, right? The left and right bundle branches, and then the right and left bundle branch bifurcate and fasciculate. Let's check plus for using big words. And when that electrical impulse goes through the bundle His, the left and right bundle branch, and the Purkinje fibers, it's going to produce on the EKG the QRS complex. And the QRS complex represents the electrolytes traveling through the remaining portion of the conduction system, the bundle of His, left and right bundle branch, and then the Purkinje fibers of both the right and left ventricle. Now, again, what's your hope? What's your prayer? That you have more than one heartbeat each day. So what you need to do is you need to reset the electrolytes so that they can do it all over again. And where the electrolytes reset in the ventricles, it produces the T wave. So the T wave represents the electrolytes resetting, or in your book, if you ever read it, that's ventricular repolarization. Repolarizing meaning resetting the electrolytes. So the QRS complex represents ventricular depolarization, or the ventricles actually producing an electrical impulse. Then the T wave represents the ventricles, the cells of the ventricles resetting those electrolytes so that you can have more than one heartbeat. So when you're taking care of a patient, you're not looking at the electrolytes moving into and out of the heart. If you have a heart patient or someone with abnormal electrolytes, they're going to have their EKG routinely monitored. So what you need to do is you need to understand how different electrolyte disturbances affect this EKG, this QRS and P wave, T wave complex. So that's a quick and dirty version of the electrical activity of the heart. Now what I want to do is I want to show you how the electrolytes actually move to produce that electrical activity. All right, so this, let me just kind of label this for you so you understand what's going on. This right here represents the cell membrane. And again, I'm kind of taking a little poetic license here, but it's to try to simplify it. This is the cell membrane of the SA node. All right, and as you learned, there are ion channels within the cell membrane. So this little doohickey here represents the blood, or the capillary, and then here, this is the inside of the SA node. All right, and again, I hate to do this to you, but if you're really going to understand this stuff, you got to know at least a little bit of this. Now, we learned that potassium's always highly concentrated intracellularly, right, inside the cell. And sodium is always highly concentrated in the blood. That's why the blood level of sodium is 135 to 145 milliequivalents, and the blood levels of potassium are only 3.5 to 5.5. So when they draw your blood, they're measuring the stuff that's in the blood, not the stuff that's inside the cell necessarily. And when we talk about the heart, we're also going to talk about the fact that calcium is in the blood. And the most important element in muscular contraction is calcium. And the heart relies very heavily on calcium from the blood in order to contract. So let's look at this for a minute. First of all, when you talk about the heart just sitting there, not doing anything, it's resting. What in your book, they talk about the resting membrane potential. Had a sneeze there, excuse me. And the resting membrane potential is really the charge that's measured inside a cell when that cell ain't doing anything. So in this case, the resting membrane potential of the SA node inside a cell, inside the SA node when it ain't doing anything, is established this way. So let me erase some of this stuff so it doesn't get too crazy. All right, so watch. Normally, what you have is the body works on a concentration gradient, right? Stuff wants to go from high concentration to low. So where's sodium and calcium highly concentrated? It's in the blood. So it wants to come into the cell. And it will go through a specific sodium ion channel and a specific calcium ion channel. And potassium is highly concentrated in the cell, so it wants to go into the blood through a specific potassium ion channel. Now, all things being equal, what you'd have at the end of the day is equal amounts of sodium and calcium in the blood and potassium, and equal amounts of sodium, calcium, potassium in the cell. But that's not the case. The reason it isn't is because potassium is 100 times more permeable than sodium or calcium. So what that means is let's say we should do this. So I'm the blood. Timmy is the blood. And you will be the cell, the inside of the SA node. And this is what you'll do, right? Every day when you come in, I will give you $2. And every day when you leave, you will give me, Timmy, $100. I really think we should do this. So at the end of the semester, who's going to be positive? Well, of course, Timmy is going to be positive. And I always make sure it works out that way. And you are going to be negative because more positive things left than entered. So one of the big things that allows a difference in charge across the SA node membrane is the fact that potassium is 100 times more permeable. Now, the other thing that goes into reestablishing and maintaining that resting membrane potential is our buddy, our pal, the one and only sodium-potassium pump. And the sodium-potassium pump has 2 seats for potassium and 3 seats for sodium. Now, sodium comes in. So as sodium's, leaking in, 3 sodiums will be bind to that pump and then get pumped out. And you're moving against the concentration gradient, against the current. And then 2 potassiums will get pumped in. And because you're working against the concentration gradient, that requires ATP, right? Now look, it's 3 sodiums and 2 potassiums. So you are moving more positive things out than you are moving positive things in. So if you make $2 a week and your bills are $3, you're going to be broke. You're broke if you only make $2 a week. You should write that down. That's why you're going to school. So these are the things that go into maintaining and developing what's called the resting membrane potential of the SA node. And it's always negative. I don't care about a number. Now, in cells that are capable of producing electricity, in addition to leak channels in the cell membrane, you also have voltage-gated channels. And voltage-gated channels open or close when a specific voltage is reached inside that cell. In this case, the SA node. And each one of these sodium, calcium, and potassium voltage-gated channels open and close at a different critical voltage inside that SA node. I'm going to make sure this is still working. Okay. Now, so the leak channels in the sodium-potassium pump are involved in developing a resting membrane potential. And remember, I'm down with RMP. Yeah, you know me. Now, I told you in the little introduction into the electrical conduction system of the heart that the heart doesn't need nerves in order to fire. That's because, whoops, I just erased my sodium. That's because sodium and calcium are naturally leaking. So once you reach that resting membrane potential, sodium and calcium begin to leak in. And because sodium and calcium are positive, it's going to cause the charge inside that SA node to become more positive. And when enough sodium and calcium leak in, it's going to hit this critical voltage called threshold. So sodium and calcium leaking in cause the charge inside that SA node to reach that critical voltage called threshold. And when that happens, you activate voltage-gated channels. And voltage-gated channels are like opening up the floodgates, not leaking in. These electrolytes flood in. So both sodium and calcium voltage-gated channels open up, and tons of sodium and calcium flood in. The calcium's used to make the heart muscle contract. The sodium is used to cause the SA node to fire or depolarization. So you need to know this. Sodium and calcium are involved in depolarization, right? Now, and that's going to cause the charge inside that SA node to just go rapidly up, right? Much more positive, and it's going to depolarize. Then you're going to hit another critical voltage right here. And at that critical voltage, right here, right here, the voltage-gated sodium channel is closed, so no more sodium is coming in. But the voltage-gated calcium channels remain open. So calcium begins to move in. It's moving. And at that time, too, the voltage-gated potassium channels open. So potassium's going to be flooding out. Calcium's going to be coming in. And the voltage-gated potassium channels allow more potassium to leave, right, than calcium to enter. So there's going to be this slow downward drift of the charge. The charge inside that SA node cell is going to become more negative, right? Starting to drop back down. Then you're going to hit another critical voltage. Oh yeah, lots of critical voltages. And what's going to happen here is the voltage-gated calcium channels are going to close. So no more calcium coming in, but the voltage-gated potassium channels remain open. So potassium's going to be flooding out. Potassium's positive, right? Positive. So if you're losing a lot of positive ions, which in this case you are, it's going to cause the charge inside that SA node cell to become more negative. And it's going to start drifting down. And as a matter of fact, it drifts down past resting. So it becomes even more negative than it was at rest. And this is called overshoot, or we'll just leave it at overshoot. And once that happens, the voltage-gated potassium channels close, and then it's the job of our buddy, our pal, the one and only sodium-potassium pump, to bring it back to resting. Then sodium and calcium leak in, leaky, 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 boom. Leaky, 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 boom. Oh, look at that. So this is really important. Potassium leaving, flooding out, causes the charge inside that SA node cell to get back to resting. So potassium flooding out is involved in I wish I could spell polarization, right? Repolarization. And where do you see repolarization on an EKG? Please get this right. You got the P wave, atrial depolarization, little delay in the AV node, then you get the QRS, ventricular depolarization, and then you get ventricular repolarization. So where do you find, or where do you see the repolarization of the ventricles? You see it on the T wave. So this is what I want to say. When you're talking about potassium, the first place that you're going to see EKG changes is in the T wave with respect to potassium. Why? Because potassium is involved in repolarization. And where do you see repolarization of the ventricles? On the T wave. So the T wave is going to be critical when you're dealing with people with high or low potassium. Say yeah. Yeah. So I'm going to leave that alone. The other thing that you have to look at too is you need to look at the action potential of a nerve, and I've embedded a little link in this PowerPoint presentation that I'm doing for you on fluid and electrolytes. So right here. So if you click on this or type it into your browser, it will show you the action potential of a nerve, which is slightly different from the heart. My point is that when you think about potassium levels, high or low, you always think about the heart and the nervous system. And I'll cover more of this in class, but it's critical that you watch this video and be prepared for our discussion on potassium and calcium and how it affects the heart and the nervous system.